Irritable bowel syndrome (IBS) is a long-term GI disorder that can cause persistent discomfort. IBS, also called as spastic colitis or nervous colon, is a chronic condition with symptoms that change over the years. IBS is very common. It affects twice as many females as males. Many factors influence IBS, and research suggests that microbes present during infectious gastroenteritis may trigger a long-term reaction. Hi, I myself, Dr. Rajiv, as gastroenterologist, would like to discuss IBS with you. In IBS, there is a change or disturbance in the bowel functions. This can cause abdominal pain and changes in bowel movements that can include loose motions, constipation, or both. IBS with diarrhea is known as IBS-D, with constipation IBS-C. If IBS causes both, then it is IBS mixed, which stands for mixed bowel habits. Signs and symptoms of IBS. It may vary from person to person and often mimic symptoms of other conditions. The common symptoms of IBS include changes in bowel habits, abdominal pain, cramping, which often reduce after passing a stool, a feeling that bowels are not empty even after passing stools, passing mucus from the rectum, swelling or bloating of the abdomen. Several factors can cause IBS to flare or even worsen. The following are some causes of the IBS. First of all, dietary factors. Dietary factors can play an important role in triggering IBS symptoms. Symptoms often worsen after a person consumes certain food products. These could include chocolates, milk, or alcohol. Some fruits, vegetables, and even sodas can also trigger the bloating and discomfort. It is very unclear that whether a food allergy or intolerance plays any role. Second, microbial imbalance. The gut contains what is known as the microbiome, which holds an ecosystem of the bacteria and other microbial organisms. Experts believe treatments that target the microbiome may help alleviate the symptoms in the future. Third is food poisoning and infections. The microbes involved in infectious gastroenteritis may have an impact on the immune system that leads to long-term changes in the gut. Infections such as gastroenteritis may trigger post-infectious IBS. Then fourth is stress. There is a connection between the brain and gut, which means that when a person experiences any kind of the stress or anxiety, it may trigger or exacerbate their IBS symptoms. Fifth, other factors. Several other factors may play a role in causing the IBS symptoms to occur. They include genetic factors, hormones, digestive organs with high sensitivity to pain, response to medications, and unusual response to infection, malfunction in the muscles that move the food through the body, and ability of the central nervous system to control the digestive system. Then flare triggers. A common trigger of IBS is flare is just eating. A person may find that certain foods have a higher chance of causing symptoms to flare or even worsen. It could be helpful for a person to record what they eat and how their symptoms respond. Taking this step could actually help them to reduce the flares in the future by avoiding the trigger foods. Other triggers are similar to triggers of IBS as a whole. They include stress, hormones, or taking certain medications. Now, how to treat IBS? Treatment options for IBS aim to relieve the symptoms and improve person's quality of the life. Treating IBS usually involves some dietary and lifestyle modifications as well as learning how to cope up with the stress. Now, dietary management. The following steps may help to relieve IBS symptoms. Avoiding sugar alternatives in some chewing gums, diet foods, and sugar-free sweets as they can cause diarrhea. Consuming more oat-based foods to reduce the gas or bloating. Not skipping the meals, eating at the same time daily, and eating very slowly. Limiting alcohol intake. Avoid carbohydrate, sugar beverages such as soda. Limiting the intake of certain fruits and vegetables. Drinking at least 8 cups of fluid per day. People avoiding gluten can decrease the risk of flares. Gluten-free food products and alternatives are now widely available. Additional dietary steps that can also actually help a person to reduce the risk of flare include only eating until full, limiting coffee, tea, or caffeinated beverages to not more than 2 cups per day, avoiding non-trigger foods. Changing in eating habits can all actually help to manage the symptoms. However, no IBS diet works for every person. A person may need to go through a process of the trial and error to find a consistent, comfortable diet that actually works for them. Then psychological and behavioral therapy. Some people may find psychological therapy useful in reducing the IBS flares and the impact of the symptoms. Techniques include hypnotherapy. This may help alter how the unconscious mind responds to physical symptoms. Cognitive behavioral therapy (CBT). This may help develop strategies for reacting differently to the condition through relaxation techniques and a positive attitude. Exercise. Exercise may reduce both symptoms of anxiety and physical symptoms of IBS in some people. Then medications. The following medications may actually help in alleviating symptoms. Antispasmodic medications. These reduce abdominal cramping and pain by relaxing the muscles in the gut. Bulk forming laxatives. These can help the person relieve of constipation. However, people should take them with caution. Anti-motility medications. These can reduce the diarrhea symptoms. Options include loperamide, which slows down contractions of the intestinal muscles. Tricyclic antidepressants (TCAs). These often help to reduce the abdominal pain and cramping. Additional medications specific to IBS treatment include allocetrone for severe diarrhea predominant IBS in females, ubiprostone for constipation predominant IBS in females, rifaximin, an antibiotic that can actually help to reduce the diarrhea in people with IBS. These are typically the last line of the treatment when other lifestyle or therapeutic interventions have not actually helped and symptoms remain severe. Diagnosis. Until recently, actually, there was no specific imaging or lab test to support the IBS diagnosis. Many people experience different types of the IBS over time. A doctor can often diagnose IBS by asking about symptoms. For example, have there been any changes in the bowel habits, such as diarrhea or constipation? Is there any pain or discomfort in the abdomen? How often is there a bloated feeling? A blood test may help rule out other possible conditions, including lactose intolerance, small intestinal bacterial overgrowth, SIBO, celiac sprue. If specific signs or symptoms suggest a different condition, further testing may be necessary. These include anemia, localized swelling in the rectum and abdomen, unexplained weight loss, abdominal pain at night, progressively worsening symptoms, significant amount of the blood in the stool, family history of the IBD, colorectal carcinoma or celiac sprue, stress, family history of the IBS, pain, sleep disorders. IBS is a GI syndrome that does not cause damage to the gastrointestinal tract. However, it can cause uncomfortable and disruptive symptoms. Though it is common, it can be difficult for a doctor to diagnose IBS due to the lack of tests available to diagnose it and the symptoms it shares with many other conditions. There is no cure actually for the IBS. However, treatments are available that can actually help a person to manage their symptoms and regain a better quality of the life. So friends, thanks for watching this video with so much patience. I just pray all you to be healthy, wealthy and prosperous in every sphere of the life.